Good news! Gone were the days where if someone is diagnosed with HIV, everyone thinks, oh, he's gonna die soon. Welcome to HIV Beyond Fear series with my e-doctor. In this series, which spans 4 weeks, we'll be having professionals and of course great people come talk to us, telling us everything we need to know about HIV to stay informed. You would not like to miss this one. See you there. HIV stands for Human Immunodeficiency Virus. This is a virus that primarily affects the body's immune system. That's the soldiers of the body, specifically the CD4 T helper lymphocyte. This virus affects the body's ability to fight against infections and certain types of cancers. With progressive HIV infection, the immune system can be damaged, leading to AIDS ultimately. With modern antiretroviral therapy, HIV is now considered a manageable chronic condition rather than a death sentence. What is the difference between HIV and AIDS? Many people use these two words interchangeably or two acronyms interchangeably. But HIV just refers to the virus itself, which is present in the blood of an infected person. And someone with HIV can live many years with the infection without even developing AIDS, provided the person has proper treatment. On the other hand, AIDS, which means acquired immunodeficiency syndrome, this is a syndrome that is characterized by severe weakening of the immune system or severe immunosuppression, and also characterized by very low CD4 count of less than 200 cells per millimeter cube. Another thing is the presence of opportunistic infections. AIDS-defining illnesses like tuberculosis, pneumocystis carinii pneumonia, cryptococcal meningitis, and Kaposi sarcoma. Not everybody living with HIV develops it, especially with early diagnosis and antiretroviral therapy. HIV is transmitted through blood, breast milk, semen, vaginal fluid, and rectal fluid. And the modes of transmission include unprotected sexual intercourse, mother-to-child transmission, either during pregnancy, during delivery, or breastfeeding, sharing of needles and other sharp objects, unsafe blood transfusions, and, of course, occupational exposure among healthcare workers. HIV is not transmitted through casual contact, handshakes, hugs, sharing of utensils, sweat, tears, or mosquito bites. What are the myths about HIV? Myth 1 is that HIV is a death sentence. The fact is that HIV is not a death sentence. With effective antiretroviral therapy, many people living with HIV are able to live long, healthy, and productive lives. Myth 2 is that you can identify people living with HIV by mere appearance. The fact is that many people living with HIV appear completely normal and healthy, sometimes even healthier than those who are not. Myth 3 is that HIV affects only a certain group of people. The fact is that anyone can acquire HIV regardless of age, gender, profession, social class, or religion. Myth 4 is that HIV can be spread through casual contact. The fact is that HIV cannot be spread through casual contact, like hugging, sharing of meals, or just touching. What is the current situation of HIV globally and in Nigeria? Globally, about 40.8 million people are living with HIV/AIDS, and sub-Saharan Africa carries the highest burden with about 67% of this number. In 2024, about 1.3 million new cases of HIV were recorded. And also in 2024, 630,000 AIDS-related deaths were also recorded. Globally, about 77% of people living with HIV are currently receiving antiretroviral therapy. In Nigeria, HIV has an adult prevalence of 1.2 to 1.3% among people aged 15 to 49 years. Approximately 1.9 million to 2 million Nigerians are currently living with HIV, and 1.6 to 1.7 million Nigerians are aware of their status and are currently receiving antiretroviral therapy. Nigeria still carries one of the highest burdens of HIV in West and Central Africa, and this is partly due to the large population size in Nigeria, the gaps in testing, stigma, and poor access to healthcare in some places. However, progress has significantly improved recently due to expanded access to antiretroviral therapy, HIV testing, and prevention programs. The concept of undetectable is equal to untransmittable. This concept means that a person living with HIV who is consistently on antiretroviral therapy and achieves an undetectable viral load cannot transmit HIV to his or her partner. This concept is scientifically proven, it is evidence-based, and it's a major tool against stigma. Undetectable is equal to untransmittable does not mean cure, and because of that, patients must still remain adherent to their antiretroviral therapy and must also monitor their viral loads regularly. This concept applies perfectly for sexual transmission. Undetectable is equal to untransmittable has transformed HIV care from fear-based management to empowerment, prevention, and improved quality of life. HIV management has evolved over the years, and today our responsibility as healthcare professionals goes beyond just prescribing medications. We must promote accurate information, encourage testing, support adherence, fight against stigma, and treat our patients with dignity and compassion. The conversation around HIV must continue to move from fear to fact, from discrimination to understanding, and from hopelessness to evidence-based care. Thank you.